All right, good morning. I'm Kyle Snider, and I serve as the president of Penn State Health's Hampton and behind us Holy Spirit Medical Centers. We appreciate the media participation today to help spread the word about a serious public health issue that continues to have a devastating effect on lives across the country, and that is impaired driving. I want to express appreciation to the Pennsylvania Department of Transportation, the Pennsylvania State Police, and Charlie Hall, the Cumberland County Coroner. Together, they are leading their educational effort in support of the National Crackdown of Impaired Driving campaign. As many of you know, Holy Spirit Medical Center is a Level 2 trauma center, which provides around-the-clock complex critical care for people with advanced life-threatening injuries. We serve 5 counties and care for over 3,600 patients a year in our trauma center. Our team of highly trained trauma surgeons, advanced practitioners, nurses, technicians, and many other specialists are available 24 hours a day to deliver the time-sensitive, specialized care needed to save lives and prevent life-altering injury to our patients. Because this team experiences firsthand the devastating impacts of impaired driving, they're deeply committed to providing evidence-based trauma prevention education to our schools, industries, senior centers, and our community. They know safe driving practices can save lives, prevent life-changing injuries, and family devastation. For this reason, education is a cornerstone of the Holy Spirit Medical Center trauma program. As a healthcare leader, a parent of a almost 16-year-old that I'm about ready to put on the road, and a community member, I thank you all for holding this event. We all have the power to dramatically reduce these tragic events, and I urge you to listen and learn from these experts and spread the word to help us save lives. With that, I'm going to turn things over to Larry Shiflett, who is the Executive Deputy Secretary for the Pennsylvania Department of Transportation. Thank you.
Thank you, Kyle, and good morning. My pleasure to be here today. Certainly a pleasure to be joined by the esteemed colleagues behind me and beside me, law enforcement, and all of our good caretakers that hopefully we don't have to see this weekend. Again, this is a really true effort to call attention to the National Crackdown Impaired Driving campaign that's ongoing and will continue through this holiday weekend. For many, Labor Day marks the end of summer, one last chance for backyard barbecues and outdoor celebrations. Pennsylvanians may drive to see family or friends, go on one last summer vacation, or just spend the day enjoying a cookout at home. Before the celebrations begin, PennDOT is reminding motorists to never, and I repeat never, drive impaired. Safety is PennDOT's most important priority. We're urging everyone to drive sober this coming holiday weekend, and not just this weekend, but always. This weekend, we're working closely with our partners who we're joined with here today and law enforcement to reduce impaired driving. The Pennsylvania State Police, along with local police, will conduct enforcement efforts through Monday, September 2nd. Motorists should know impaired driving enforcement goes beyond just alcohol impairment. Law enforcement also works to identify motorists impaired by illegal drugs, prescription drugs and medication, or a combination of any of these. Impairment is impairment. While illegal drugs are especially dangerous when combined with driving, it's equally as important to always read your prescription labels. When your medication warning labels reads, "Do not operate heavy machinery," you should avoid driving until you know how that drug specifically affects you. PennDOT data shows there are 133 alcohol-related crashes, resulting in 8 fatalities over the Labor Day holiday weekend last year. In addition to that, there were 41 drug-related crashes, resulting in an additional 5 fatalities during that same holiday weekend last year. These numbers should, in reality, be zero. Crashes involving impaired drivers are completely preventable. If your celebration this weekend includes alcohol or drugs, plan to get home safely. Choose a designated driver. Choose a rideshare service, public transportation, but never, ever choose to drive impaired. Remember, a designated driver is a person who has had nothing to drink, not the least amount to drink. Designated drivers should take their roles equally as responsible and serious and not consume any alcohol, not even one drink. Even a small amount of alcohol or controlled substance can alter someone's ability to drive safely. And again, remember, safety is everyone's responsibility. Be safe this Labor Day and always, but also enjoy this Labor Day and one last summer weekend, even though standing here today, summer doesn't feel like it may end anytime soon. But again, thank you. And now I want to turn it over to the Department of Drug and Alcohol Programs Deputy Secretary Kelly Primis.
Hi, good morning. As mentioned, I'm Kelly Primis, Deputy Secretary for the Department of Drug and Alcohol Services, or DDAP. And on behalf of Secretary Davis-Jones and our entire department, I want to thank everyone here today for the critical work you do. We appreciate such a committed group of people that is so passionate about public health and their communities. The key to stopping impaired driving starts long before taking a driver's test or getting behind the wheel. And that key is prevention. We know that prevention really is our first line of defense when it comes to combating impaired driving and helping to ensure that people don't develop substance use disorders. In the drug and alcohol field, we know that treatment and services are vital after a person develops a substance use disorder. However, if we don't get upstream of this, we won't be able to impact future substance use and push back against issues like impaired driving. As the leader of the state's efforts to reduce and prevent substance use disorders, much of the work DDAP does centers on the goal of fostering improved health outcomes for generations of Pennsylvanians. According to the CDC, the majority of adults who meet the criteria for having a substance use disorder started using substances during their teen and young adult years, right at the intersection of getting a driver's license and having more independence. It is vitally important that we provide our youth with the knowledge and prevention tools to make the right decisions when it comes to drugs and alcohol and driving while impaired. By promoting prevention, all Pennsylvania children and the communities they belong to can thrive. One way DDAP works with local communities on prevention activities is through the Student Assistance Program. The Pennsylvania Student Assistance Program trains school staff to identify alcohol, tobacco, other drugs, and mental health issues that may act as barriers to a student's success. The SAP staff work with school staff, the student, family, and others to address risk and protective factors, as well as interventions and supports to help students succeed in the school and community. And this collaboration is an important part of the prevention puzzle. The Pennsylvania Drug Take-Back Program is another important prevention tool. The Take-Back Program provides a safe way to dispose of old or unwanted medication, because we know that the majority of misused prescription medications, including opioids, often come from a medicine cabinet that's in the home. And please know that DDAP offers 24/7 help for anyone who is struggling with substance use disorders. DDAP's Get Help Now hotline is a trusted resource that is available 365 days a year, even on holidays like the one we'll celebrate this weekend. The Get Help Now hotline number is 1-800-662-HELP or 1-800-662-4357. Whether you're an individual in need of services or a family member inquiring about services for a loved one, trained individuals can help you navigate local resources and treatment options in your area, regardless of your insurance coverage. Please don't think twice about making this call, and remember that recovery is possible. In closing, on behalf of Governor Shapiro and all of the people in his cabinet who are here today, please know that we believe that it is a sign of true strength to seek help for substance use in order to lead a happy and healthy life, something we wish for all Pennsylvanians. And we encourage everyone to celebrate responsibly this holiday and beyond to prevent impaired driving. Now I'd like to introduce Lieutenant Adam Reed with the Pennsylvania State Police, who will speak to the agency's role of enforcement and removing unsafe drivers from the road. Thank you. Adam?
Thank you, and good morning, everyone. Thank you to Deputy Secretary Primis. I'm happy to be here to represent the Pennsylvania State Police this morning as we gather with our safety partners to push out this important reminder ahead of the holiday weekend. Last year, on Labor Day weekend, troopers investigated 671 traffic crashes with 10 fatalities associated. Those crashes involved over 200 injuries. Alcohol was a factor in 61 of those, including 2 fatal crashes. Troopers were proactive, making over 500 DUI arrests across Pennsylvania, and also cited over 9,000 drivers for speeding. This year, Pennsylvania State Police will again be out in full force to keep our roadways safe. This will include DUI checkpoints, DUI roving patrols, and an increased traffic safety enforcement presence overall. A large part of our DUI enforcement is made possible by the work of our drug recognition experts, or DREs as we call them. If a driver is suspected of being under the influence of legal or illegal drugs, troopers will conduct field sobriety testing. If necessary, they'll summon a certified drug recognition expert to expertly assess the driver's condition. DREs receive specialized training to distinguish the physiological signs of impairment caused by many controlled substances, both legal and illegal drugs. Following today's lineup of speakers, our Pennsylvania State Police Corporal Nick Zulik will be providing a hands-on demonstration behind you in front of the DUI Mobile Memorial there. He'll be demonstrating the scientific nature and thoroughness of these DRE assessments. Corporal Zulik is a certified DRE and manages our agency's DUI operations unit within the Bureau of Patrol. Driving under the influence is a very serious crime that comes with severe penalties. Even a first offense can result in prison time, a 12-month suspension of a driver's license, and a very high fine, anywhere between $300 and $5,000. The worst penalty, however, can be serious injury or death to yourself or another you're sharing the road with. Please, don't do it. It's simply not worth it. On behalf of the Pennsylvania State Police, please enjoy the holiday responsibly. However, don't get behind the wheel impaired. Thank you, and I would like to now introduce Dr. Dale Dangleben, Medical Director of Trauma Services and Chief of Surgery here at Penn State Health Holy Spirit Medical Center. Doctor?
Thank you. Well, it's a good thing I put some stuff on paper. I see everyone has it. Good day. I'm Dr. Dale Dangleben. I'm the Trauma Medical Director here at Penn State Holy Spirit. We started 8 years ago, to be exact, and we had such a function here in 2017 on this very same, location. So thank you for joining us today to discuss an issue that is both critical and deeply personal to me as a trauma surgeon. I have been doing this for over 20 years, all of my career in the state of Pennsylvania, after medical school here, and it is a devastating firsthand. I see the firsthand devastation of drunk driving, and I stand today before you not just as a physician, surgeon, but as an advocate for our community in terms of safety and well-being. I know some of the speakers before me have emphasized some data. Again, it's not just a state issue, it's a national issue. We're talking about over 11,000 fatalities a year from drunk driving across the United States. And again, this is all because of the influence of alcohol. I know there are other factors that have been spoken about, and we're not going to go too in depth on that. These are not just statistics, you know, these are people, these are mothers, fathers, sons, daughters, friends, neighbors, right? And I think everyone knows someone who's been involved in some sort of tragedy like this. So again, these lives are cut short, forever altered. And we're in the trauma bay, working with our EMS colleague, working with law enforcement to receive these patients, and the things that we see sometimes are extremely devastating. But it's one thing that we're in the operating room trying to save a life, but it's also extremely devastating when we have to go out and talk to the loved ones. I call that the secondary trauma of drunk driving. And that is, to me, another piece that's left behind. Not just the person driving drunk, but the other individual that they've impacted if they run over someone else. So again, we are here in the trauma base of Holy Spirit. We've grown our trauma program. Mr. Snider mentioned 3,600 traumas, and we're here. There's 8 trauma surgeons now. We're very proud of the program that we've built, and we're here to serve our community. The reality is that drunk driving is entirely preventable. There is no excuse, no justification, and no acceptable reason to drive while impaired. And I did look at the data on rideshare, such as Lyft and Uber. It has moved the needle just a little, but not significant across the country. 1/3 of all motor vehicle accident involves drunk driving. These are actual factual data out there that you can look. I call upon every one of us today to take a stand against drunk driving. Talk to your friends and your family members about the dangers. Education, I think, is one of the most important things, but not just talking, but acting upon it. Set an example by making responsible choices for yourself and for your family and friends. If you know someone who is impaired, do everything you can to prevent them from getting behind the wheel. And if you see someone driving erratically, report it. Your actions could save a life or many lives. Because remember, it's not just the individual behind the wheel that's intoxicated, that's affected. Sometimes many more in that vehicle and outside that vehicle are affected. We have to remain vigilant and proactive and take time, not just around Labor Day, but throughout the course of the year, to emphasize these messages that we're sending out today. We must all be leaders in advocating for change and supporting initiatives that prioritize safety and prevention. And that's what we're about. I would like to acknowledge my prevention coordinator, Sonny Goodyear. We're out in the community. We're reaching out, not just on drunk driving, but all aspects of trauma. And that is very, very important to us here at Holy Spirit as a trauma program. Finally, remember that drunk driving is not just a crime. It is a preventable tragedy. Each of us has a role to play in creating a safer and more responsible community, and we must continue to work together. I'm on call this weekend. I'll be here taking care of the issues that continues to, affect our community. But each and every one of us can make a difference. Thank you. Oh, sorry about that. Oh, at this point, I would like to introduce Charlie Hall, Cumberland County Coroner.
Good morning, everyone. First, I'd like to thank PennDOT and Penn State Holy Spirit for staging this event and trying to make people more aware of the consequences of impaired driving. I've been the coroner since 2012, and prior to that, I was a police officer for 26 years. So I've seen the effects of impaired driving for 38 years, and it never gets any easier for me or my staff or the loved ones of the victims of impaired driving. My office investigates approximately 35 fatal crashes every year, and at least 15% of those are a result of impaired driving. It never gets any easier knocking on the door in the middle of the night to tell somebody that their loved one's not coming home. And that would be even higher if it wouldn't be for Penn State's trauma center here being able to save some of them. You know, and they bring them in from all over here to Holy Spirit. So, you know, if the crash happens in Dauphin County or Perry County or whatever, and they bring them in here and they end up passing away, it becomes a Cumberland County case. So it never gets any easier for me to, you know, to make the notifications to next of kin. My numbers just keep going up with that. And this weekend, you know, is Labor Day weekend. Everybody wants to go out and celebrate the end of summer and all that stuff. But think wisely, and if you're going to drink, use a designated driver, use Uber, use something. Don't be trying to drive impaired, whether it be with drugs or alcohol or whatever, because, you know, I'm going to end up being your last responder. You know, I used to be a first responder, now I'm the last responder. So you don't want to become one of my statistics, and I'd appreciate it if you don't. So I thank everybody for coming out, and I thank the media for making everybody aware of the problems with impaired driving, and hopefully we can get through this weekend without anybody getting killed in impaired driving. Thank you so much.
Okay, that concludes our lineup of speakers. Any questions we could take? All right, seeing none, we'll then move to our DRE, field sobriety demonstration here. We're going to hold that right in front of the Victims Memorial trailer there behind us. Participating is obviously Corporal Zulik, who I introduced, and the actor is Mr. Miles Snider from the PSP Communications Office.
As Lieutenant Reed said, my name is Corporal Nicholas Zulik. I'm a certified drug recognition expert through NHTSA and the International Association of Chiefs of Police. We are a post-arrest procedure support to our troopers and officers across the Commonwealth. When an officer believes that someone is impaired under a controlled substance, we will come in and do an evaluation involving 12 steps to identify what drug category the individual is under. The first step would be to administer a preliminary breath test to ensure that alcohol is not the sole reason for the impairment. As long as that is under a 0.08, we will go on and interview the arresting officer. We will see what signs and symptoms they observed during the traffic stop. Some drugs move fast through the system, so we have to ensure that that is not one of the drugs that could be in there. The next thing I will do is what's called a preliminary examination. We begin to explain this is a voluntary procedure. We read the Miranda warnings because they are in police custody. And I would ask a series of questions. I want to ensure that there's no medical issues going on, and this is our first opportunity to examine the individual to see if there's any kinds of signs and symptoms that we see. These can include falling asleep, being anxious, talkative, just how they answer the questions as well. After that, I will get a pulse check, because during the evaluation we're going to check vital signs. So I would get a first pulse check. We will do this 3 times throughout the evaluation. The next step would be an eye exam. We do 2 eye exams. One would be the horizontal gaze nystagmus test, which would be part of your standardized field sobriety test, and what we call the lack of convergence test. So I would have the individual stand with his feet together, hands down on his sides. See, it's my pen here. What I need you to do is follow this with your eyes only, don't move your head. It's going to do a series of small circles around your face, and it's going to come in towards your bridge of your nose. All I need you to do is follow this with your eyes. Do you understand? So I'm checking to see if his eyes are going to converge towards the tip of my pen. The next step of the process would be the divided attention test. So that would include the modified Romberg balance test, the finger to nose test, walk and turn, and one leg stand on both feet. So I'll demonstrate the modified Romberg balance test. So you're going to stand with your feet together, hands down on your sides like I am. When I tell you to, what you're going to do, sir, is you're going to touch your head back here and look at the sky. I'm going to tell you to close your eyes. The next thing you're going to hear is start. When I say start, what I need you to do is when you believe 30 seconds has gone by, you're gonna tilt your head back down, open your eyes, and verbalize stop for me, okay? Do you have any questions?
Yeah. Good. Tilt your head back.
Close your eyes, and start. For this test, a couple things I'm looking for are tremors throughout the body, including eye, body, and leg tremors. If there's any sway to his body, it's also a good opportunity to look up the nasal cavity to see if there's any kind of controlled substances that would be up there, as that is a common ingestion site. I'm looking to see if his body clock is going to be fast, slow, or right on, as different substances cause that to change. How long do you think that was?
31.
31. So that was about 37. So a little slow. We'll run through all those field sobriety tests. Step 6 would be vital signs. So it's going to be an opportunity to get a second pulse. I'm also going to check his blood pressure and his temperature. After that will be a preliminary an eye exam. So we check pupil sizes in 3 different lighting conditions. The first would be just a normal room light. I then turn the lights off into a dark room, let his eyes dilate for 90 seconds, and then check them again. And then finally would be in direct light. So there's a medical light that I use, and also I have a card to measure his pupil sizes in each of those lighting conditions. After that would be a muscle tone examination. Third pulse check would be the 9th step, as long with a ingestion sites. So we look mainly for the arms and the hands. So I'd have his roll his sleeves up to see if there's any kind of injection sites along his arms or his hands or anywhere else. Another common site we see sometimes here in the neck area as well. So we check to see those and mark those. And then finally, I'll review everything that I have, and then I will have it will be a chance for his statement. Usually how it will go is, I believe you're under this substance or this drug category, when is the last time you used, and see if we can get a timeline to confirm what I'm seeing. After that, if we see the impairment under certain drug categories, we'll tell the officer then to draw blood. I will give an opinion of that drug category. Toxicology comes out, and we're going to document that if they give blood, and we do document that to ensure proficiency within our unit. Any questions?
Not super. We do red hair in the family.
PennDOT is reminding motorists to never, and I repeat never, drive impaired. Safety is PennDOT's most important priority. We're urging everyone to drive sober, resulting in 8 fatalities over the Labor Day holiday weekend last year. In addition to that, there were 41 drug-related crashes, resulting in an additional 5 fatalities during that same holiday weekend last year.
Our youth with the knowledge and prevention tools to make the right decisions when it comes to drugs and alcohol and driving while impaired. By promoting prevention, all Pennsylvania children and the communities they belong to can thrive. To dispose of old or unwanted medication, because we know that the majority of misused prescription medications, including opioids, often come from the medicine cabinet that's in the home. And please know that DDAP offers 24/7 help for anyone who is struggling with substance use disorders. DDAP
But it's one thing that we're in the operating room trying to save a life, but it's also extremely devastating when we have to go out and talk to the loved ones. I call that the secondary trauma of drunk driving. And that is, to me, another piece that was built, and we're here to serve our community. The reality is that drunk driving is entirely preventable. There is no excuse, no justification, and no acceptable reason to drive while impaired. And I did look at the data on rideshare, such as Lyft and Uber. It has moved the needle just a little, but not significant across the country.
Unless you want.
Okay, I have 6 total speakers, so I have 5 people plus the person at the podium at any one time who need to be up front. And then I have as many as 4, 5, 6 police officers.
Do you have a sergeant or somebody that's?
PSP is here. Well, Adam
Is that
Reed
6?
speaking, actually. He's part of
We can get through this weekend without anybody getting killed in impaired driving. Thank you so much.
That concludes our lineup of speakers. Any questions we